the abdomen, upper right part of the abdomen. And then we said the liver is one of those structures that is able to regenerate itself. So it can be cut out and transplanted to another person that is in need of a liver. Then we also talked about the things that affect the liver. Talked about drugs, talked about lifestyles, talked about use of herbal concoctions and how they impede the liver. Then we also talked about some viruses that specifically affect the liver. And we talked about the one that has a cure, that is expensive, and the only one that has a vaccination but doesn't have a cure yet. It's waiting for me to discover it. Then we stressed on the fact that if you have not been vaccinated, you should go and get vaccinated. So we talked about how it is transmitted. Blood, sharp objects, body fluids. And then there's one which is very important that I didn't state. Mother to child. That's vertical transmission. So ending at mother to child will make many people start becoming afraid. So I'm going to also close that chapter. So mother and child that's not the end of it. It can be transmitted to mother and child if the woman has never been the type that goes for antenatal. Nobody finds out. The woman gave birth to the child, maybe at home or something. And then the child grows up, the child most likely will have it. But if you found out you're going for antenatal and everything, there's always a solution for it. The God we serve is very marvelous. There's some things that we cannot yet fathom. The placenta that connects the mother to the baby, I don't know how God designed it, but it doesn't just allow anything pass through. Only things that are necessary for the baby that passes through. So you might have somebody that has serious HIV, serious one, and is pregnant, but there's always a defense. It's not as if the child gets the HIV right in the womb and everything. No. At the point of separating the baby's delivered, separating the placenta, that's when the mother's blood mixes with the baby's blood. So that's when he now introduces those viruses to that system. And that's when swift action is taken to immediately clear it off before it starts multiplying. That's why when children with mothers that have HIV, they are known. Once the mothers comply with treatment for them, they find out how we classify the mothers as, we classify the babies as high risk. Maybe for a mother that is almost 10, almost close to delivery, and then just found out she's HIV positive. That baby has been exposed for a long time, and the mother has never received treatment before. There's also a treatment for that. So it helps clear the baby, and then by the time the baby is 1 year, discover the baby is HIV negative. It's not as if HIV has the cure. But just like some people have been exposed to the virus before, their immunity was strong enough and it never infected them. So at that point, you are helping the baby push out those viruses by the aid of the drugs that are used to treat the virus. So it helps the baby push them out. Once they are out of the system, that mixture that came from the placenta at the point of cutting. By the time they keep on checking the baby, and then the baby is free. The babies that end up with HIV are the ones that at the point of giving birth to them, maybe almost 2 months, nobody knew that the mother was HIV. Maybe the mother, even to make it worse, the mother died at birth. So most of them, nobody knows. The mother, if the mother doesn't tell you, I have this, you will not know. Until maybe the child start falling sick. Most of them, even after they have been exposed afterwards, they came out 2 months. Over time, the virus would have been multiplying. Some of them end up having it for life. So it's the same mechanism. Once the child is out, at the point of cutting, the mother's blood mixes with the child's blood through the placenta. But there's an immunoglobulin that's been made specifically against hepatitis B virus. That is action in itself. It's meant to fight it. It's not a cure. It's meant to fight it, suppress it, reduce it. So that immunoglobulin was taken from people that have been exposed. They derive and they take that immunoglobulin, the cell that fought off that particular hepatitis B at the point of exposure in someone's life, and then they multiplied it. So when the child comes out, they inject the child with that immunoglobulin. So that's action itself. That's something that has gotten victory at one point in time. So we insert it, inject the child, so you start fighting off any remnants that want to come into the blood and clears it off. Then the child can now go through immunization to support itself. So that's how it is. So as it will be wrong to say mother to child and not tell you that there's a way out before we start getting afraid and everything. So that's that about the kidney. So I will be going to the liver. So the liver is also is as important as the brain and is as important as the heart, because the liver takes 20% of the blood supply the body gives. 20% of it. And when it comes to controlling your blood pressure, it is the liver that does it at the long term. Every other thing that comes, the drugs, they do it short interval. That's why you see you take it once every day, some, and everything. But the liver's work is to regulate your body fluid. And what is blood? Almost 98% of it is body fluid. The rest are just the cells that make it up to that 100%. Blood is 98% water. I say 98, 97 or something. But that major percentage of blood is water. And it's part of what the kidney controls. So that's how it controls the blood pressure in the long term. There are some drugs that mimic this mechanism. They are water pills. They use them to also like antihypertensives. Once you take them, it helps the kidney to excrete more water and thus reduces the pressure. Now, when we talk about blood pressure as related to the kidney, it's just physics. Pressure, something is flowing. The speed and the pressure it is exerting. That's just the pressure we are talking about in a compartment. In a compartment. Physics will tell you that the area over force over area is pressure. So the higher the area, the lesser the pressure. So some of these drugs you use, what they do is this. Where the blood flows through, they expand it. So they reduce the pressure. Because it's easy for me to walk here. I'm not under any pressure. But imagine it's a very tight space. And I'll be pushing myself little by little, trying to get to the end. And I don't want to stop. I'm not even meant to stop. I'll just be pushing myself. I'm putting more pressure on myself. That's simply what they mean by blood pressure. So some of those drugs, they expand the vessel, relax it, make it more wider, so the blood can flow more freely. Then the ones from the water pill, they reduce the water in your body, thus reducing that force of flow. Reducing the force of flow. And basically, I'm not here to talk about BP or hypertension or anything. I'm just telling you how the kidney works. Now, the major aspects they want me to stress out. We know many people have kidney issues. And we have young people now coming down with kidney issues. And I'm going to deal with every aspect of it. Now, talking about cosmetics. There are many cosmetics that affect the kidneys. It goes from your hair, what you use on the hair. There's no way you rub the cream on the hair, it doesn't touch the scalp. So they are the ones that are absorbed in the scalp. That they are part of hair creams. They are absorbed in the scalp. Those ones form, once they get converted in the body, they form calcium and calcium readily forms crystals. So those crystals, they go to the kidney and then they block the sieve that is there. So that block causes toxicity and start damaging the kidney. And then the person has a kidney issue from there. Then the common one we know about is mercury. Mercury is toxic. You found them in all these bleaching creams. Hydroquinone, bleaching creams. They are toxic. They destroy the kidney. The kidney has a sieve, and the sieve has a name. Ultrafiltration. It's not just filtration. When they say ultrafiltration, that means very tiny. It's limited to what it can allow pass through. Proteins are heavy. They are very heavy substances. So kidney doesn't allow them. So that's why sometimes when you check the kidney function, you look your urine, you start seeing protein. You might be asking question, where is this one coming from? So I'm still going to shed more light on that so that you don't see every time you just see protein in your urine. That's why I don't get kidney problem. No, it's not every time. It's not every time. So those bleaching creams, the skin absorbs them, it gets to the blood, and like I tell you, 20% of what gets to the blood gets to the kidney. For a 70 kg man, blood flow, let's say, should be about the water part of the body is about 60% of the body weight. Now if you say the total liter of blood in a man is about 3 liters or something upwards or so. Now 20% of that goes to the kidney. You know how heavy 20% is? It signifies how important that organ is. So anything that enters the blood will definitely get to the kidney. And if it start accumulating, it starts destroying the kidneys. Then the one for lipstick, there are also lipstick that have constituents that will be absorbed. They also get to the kidney, poison the kidney, damage the kidney. So when they damage the kidney start allowing proteins that normally shouldn't allow to enter. And those proteins accumulate. They now block the passageway. They block the passageway for other stuffs that the kidney is meant to excrete to pass through. So you now start discovering that in the blood, those substances that the kidney is supposed to excrete, they are still there because something has blocked their passageway. The kidney is receiving damage, you're not able to do the work. God gave us 2. So most of the times, we don't feel it until it gets to the point where the 2 of them are actually affected. One can no longer carry the work, so that one too is failing. One is already damaged beyond that you cannot see inside that this one is damaged beyond repair because one is taking the blame. Is doing the work. That's why you see people donate their kidneys because they can do with one. So far as they are willing to live a healthy life that will support their kidney. So that particular one is doing the work. Doing the work that 2 is supposed to do. Over time you will get tired. And then because you are tired, it's just like somebody overworking, suddenly just one day died of heart attack because he has been overworking. So that kidney also fails. And then its function, he can no longer do it again. If he used to carry one bag of rice on his head every time, this time he cannot even carry a bucket of water. So that's how gradually it begins to weaken. And if nothing is done to assist it, it fails completely. So that's where dialysis comes. Dialysis comes when people get to the point where they need dialysis. Those drugs, water pills, cannot help them anymore. They use dialysis. Dialysis takes the blood from them, sieves it, removes the excreta, and then replaces it with something else, a chemical. And then those people are usually being transfused. So the dialysis helps the kidney to take that burden away. Some people can get to the point they do 1-2 sessions of dialysis, is not still enough. At that point, you now start saying, hey, the kidney has entered end organ failure. You now be looking for a kidney to transplant to replace the kidneys. So for some, when they say somebody has gotten to the point of kidney transplant, simply means the 2 kidneys are gone. That's what it means. The 2 kidneys are gone. And all of this, are these chemicals that cause it. The common ones we see around is the bleaching cream. They are heavy metals and they destroy. Mercury itself is toxic and they destroy. Then drugs. It's not only the liver that excretes drugs. The kidney also has a role in excreting drugs. So if a diabetic person, the diabetes affects the kidney, it becomes like a chain reaction. There's a drug that helps to control diabetes, but the kidney helps excrete it. And the reason why they help excrete it is because the more it stays, the more it continues to do its work. So you discover somebody that is diabetic and also has a kidney compromise. He just took a drug, metformin, and then the person that is diabetic is always having a low sugar, and you're asking yourself, why now? This person is diabetic because that drug has not yet left the system. The kidney that is supposed to excrete it out has not done it because he cannot do it because his functions are limited. So over time, he starts doing it little by little. At that point, they stop the drug for that person and allow the kidney to remove it completely. Monitor the person before you start giving more, and then they lower the dose of the drug so that the kidney can be able to excrete it faster. So that's that. So these drugs, major drugs, hard drugs, some of them, they have this ability to cause what we call vasoconstriction. When I mean vasoconstriction, constriction is simply reducing the size of a vessel. That's why I say vessel. Vessel is the vessel. Constriction is reducing the size. So, like we said, physics, once the area reduces, the pressure increases. Once the area increases, the pressure reduces. So, when something that is this large suddenly becomes very tiny, the blood flowing through it has to be under pressure. So automatically the pressure goes up. And as that pressure goes up, the pressure is everywhere. The pressure is affecting the blood that is also at the kidney level, where the kidney has to receive its own blood. It's everywhere. It's in the brain. It's in the heart. So when they take these drugs, it causes serious vasoconstrictions in them, and their blood pressure shoots up. Some of them jump into coma and never come out of it. They jump into coma and never come out of it. Immediately the blood pressure shot up. A vessel that could not handle that outburst of the pressure that came just burst. And then started bleeding. And that's how their consciousness just fades away, because the brain is the organ that maintains our consciousness. Before, it just fades away. Depending on the caliber of the bleed. Once the caliber of the bleed is very small, you might be maintaining your consciousness, but you discover that you are losing function. Maybe the part that has happened is what controls the right side of your body, or controls your ability to speak. You discover that your speech is becoming slurred gradually, and it's progressing. Those people, when they do a CT scan of the brain, we have to tell, okay, there's a bleed somewhere. How big is it? Can we handle it? You handle it and it goes. Then start treating the person to recover. But some people, they are unfortunate. The vessel that bursts in their brain is so big that you cannot do anything about it. You are trying to reverse the process, but it's too big. And then from them, they enter into coma and they are gone. So some of them that survive, they don't know that their BP is high. There are some people that they have a stretching limit. That they are elastic, their vessels is more elastic than others. So they can accommodate much pressure. But they don't know that, except they come to the hospital for one reason or the other, they will not know that their blood pressure has always been high. So over time, the kidney is receiving the pressure, damage over time. Then at a point, bam, you just discover they woke up one morning, their face is swollen. The kidney is now showing symptoms and everything. That something is happening. No. Let's go and check kidney function. Discover the kidney function is deranged. Like I said, there are two kidneys. One we always mark the effect of one when it's being destroyed. But when the two of them are affected, the evidence will show, because both of them can no longer do the work. So these are things that hard drug does to people. I've seen many young people just die because of hard drugs. I've seen people, there was a gentleman that's been doing drugs. He thinks that that's the way of life, it's a big boy life and everything. He go to the point of chronic kidney disease. And that's not the sad part of it. The sad part of it is that the mother had to pay for the price. The mother was coming from Abuja to come and see him in Asaba. They got robbed and was shot dead. So there are many things that might not be the one. The big guy eventually, at one point, he was showing signs as if he was not even recovering. Then eventually he recovered. He recovered. And I told myself that this one, he's going to live with this for the rest of his life. That is his way of life that caused his mother to die. And I think maybe that will make him have a change of heart and stop doing drugs. So eventually it was looking as if he was not going to. They are doing dialysis first session, second session, his body was still swollen. And after a while, just once, he just discovered his body was, the water was just leaving his body. Maybe God had mercy on him because he has lost more than anything. But we are looking as if that this guy maybe might not make it. But eventually, just everything just turned around. And then, all the water that was swollen in all part of it. But at the point when you see him, he was very chubby. At the point I passed the guy, I didn't even recognize him. When I saw the sisters beside him, that's when I knew that, this is the guy. And I look at the face, this is the guy. When he came, he was so full. Very full. But now, it was as if he became lean. Very lean, because the water has been taken off. And it's now improving. So, there are very important issues. Drugs, cosmetics. It's best you avoid them. It is very best that you avoid unnecessary cosmetics. And try your best. Anything you're using, check what is the component. Browse each of those components. What does it have to do with kidney? How does it damage it? Some companies now, they will not even tell you that there is hydroquinone inside this. They will just tell you this thing free. This thing free. So you buy it and so on. So the more I could say is that the skin God gave to you, accept it that way. Maintain it so that you not put yourself into unnecessary problems. So I don't know if anybody has any question. Any question you want to have? I'm already done with my talk. Okay. Yes. Okay. Okay. So for there's hair straightening, keratin treatment. So we have these ones. We have glyoxylic acid and then formaldehyde. Formaldehyde is what is usually used to preserve dead bodies. So those ones, they are the ones that usually break down and form calcium crystals that block the tubules and start damaging it. Then the one that has to do with bleaching cream and mercury and hydroquinone. Then, as much as nail polishes and hardeners, you have things like toluene, dibutyl phthalate. Then deep chemical pills, all those pills that help you shed off skins and everything. You have things like phenol and high percentage glycolic acid. So all these things are online. You can browse. Chemicals cosmetics that damage your kidney. You will know, they will categorize it to the ones that are in the hair, the ones that are for bleaching, the ones that have to do with your nails, as much as your nails are. I don't know nail hardness, man. I need a fixed nail, so me, I don't know. So they will tell you this one. So whatever you're using, look out for these ingredients. Are they there? Like I told you, some companies, they know how to hide. Yes, they know how to hide. They will just tell you it is free, but it's actually inside. They tell you this one need a bleach, but discover that as they're rubbing the cream, you're getting fairer and fairer and fairer. So that's that. There are also some soaps that have this content. So any other question? Thank you.
Herbal drugs. How about taking agbo for pains? No.
Okay.
Then all that small herbal. Then all
Uh,
these Chinese supplements as well.
okay. So I usually tell people what you don't need, don't go for it. At the point when young people started developing kidney issues was when something about a green tea came. They say it's for slim tea, and then they started drinking it and started developing kidney issues. Young people started developing kidney issues. So whatever you don't need, don't go for it. Your Lipton tea, I've been taking it since you're small. You don't get kidney problem. Stick to your Lipton tea. If you want drink tea, stick to your Lipton tea. There are many products that are out there. You don't know the manufacturer. I just want to sell. If they tell you this, and ladies are very, very particular about slim tea. I want slim. I tell people that if there's anything like that, the celebrities you say about yapping themselves about who is fat, they don't slim finish. Oh. So don't let anybody disturb you that there's something outside there that will make you slim. If you want to slim, then go and work out. So, any other question? Okay, thank you very much. Okay.
Please let's put our hands together for Dr. Olord. Thank you so much, sir.